one of the results of that is the fact that not long-term thinking leads to a lot of problems. And these statistics were really interesting. Nearly half of healthcare leaders are considering leaving their organization. And it's really creating that retention crisis that we're seeing right now. And 43% of healthcare leaders consider their ability to attract quality candidates to be extremely or very challenging, which is an incredible number. And Dr. Garcia, just wanted to, what innovative strategies can organizations implement to keep top talent engaged and committed? What are you seeing? What's working?
Yeah, Lucas, we used to concentrate only in recruitment, and what we know right now is that now not only we need to be strategic about recruitment, but also about the retention of our workforce. Our people are our biggest asset, our most valuable asset, and we need to pay attention to retention. There is an alarming shortage of workforce. In this country, the demographics have inverted, and with the baby boomers getting into the retirement age, now less people in the workforce are taking care of a significant larger volume of people. The Association for Academic Medical Colleges, for example, is calculating that by 2034, this is just around the corner, in 10 years, we're going to have a shortage of about 130,000 physicians. And if you consider that with what happened in the after COVID phenomenon, where of the existing physicians, 30% of them are considering early retirement, or the high levels of burnout, which by the way is real, burnout is real, 50% of our workforce recognizes symptoms of burnout. And then the competing with other industries. We used to say our competition is a hospital across town. Well, now we're competing not only regionally and nationally with other industries. An example is an Uber driver, an entry-level position for environmental services at a low pay rate. They can go and drive an Uber today and perhaps make more money in a more flexible situation. And then the cost of turnover, right? I mean, we calculate that the cost of turning over a physician could be anything from $250,000 to $500,000 for an organization. So some approaches and solutions that we're seeing, we had to adapt, and we have to start looking at, can we develop part-time employment where it didn't exist? In the physician side, we used to say you're full-time equivalent or not, Monday to Friday or a full-time call. Now we accept somebody that say, I want to work for you only for 0.2, and I only want to cover Saturdays and Sundays. Another phenomenon that we're seeing is the hybrid environment, for example, in radiology. You don't have to have your employed radiologist in-house all the time. Of course, there are boundaries for licensure and reimbursement, but you could have radiologists working hybrid and mostly virtual and still provide the care that you need. We're seeing companies proactively investing in their people. A lot more of the chief wellness officers, the succession planning, it's more intentional that we are doing that right now, listening to what our people want and need and being flexible as we satisfy that. And then a switch from lagging indicators. From lagging to leading indicators. We used to say, well, let's look at the exit interviews and see what we learned. Well, guess what? An exit interview is too late already. You already lost that person, right? So what leading indicators and how are we using AI, for example, to predict who could be leaving your organization so you could do something about it before that happens? But the big challenge, Lucas, is that the experience of our employees can't be measured by a P&L, and it doesn't happen overnight. So truly building the culture that supports our people is essential, and that takes a lot of hard work, a lot of resilience, a lot of different conversations, but it is instrumental for the success of the company.